Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Now, in order for a woman to know the right sexual response, she has to know what normal sexual response is. Okay, so we talk about arousal. We said the normal sexual response will be lubrication. If you have lubrication after proper stimulation, and we said intercourse is not a stimulation. Intercourse is the last thing you want to do, because after intercourse you will have your orgasm and the pleasure has been lost. So it is beneficial for both men and women to extend this period as much as you possibly can to enjoy each other very well. Now, so if you feel the woman is lubricated, then she is ready for intercourse, then that's a good sign. That's a good sign that, okay, the woman is ready for intercourse. Now you try as long as possible to maintain the intercourse so the woman can have her orgasm once, twice, 3 times. It depends. There are multi-orgasmic women. There is two times orgasm woman, but at least is once. Okay. If you communicate with each other, you will know when she has her orgasm, because you will feel the contractions in the vagina and in the lower third of the vagina, especially, and the lower third of the pelvis. Her pelvic floor will contract. You will see physiological changes. You know that this woman already have her orgasm. Okay? I cannot take calls, please. Okay? So you understand what I'm saying? Yes. So that is exactly the point. So now, back again, how would a woman know where is her likes? Where is the sensitive point? Every woman have a sensitive point. The clitoris is the most sensitive area of a woman. If the roof of the vagina, the upper section of the vagina, the roof right under the clitoris, you go to the vagina, the roof of the vagina is many folded. You see like rigid folds. This is the base of the clitoris. Most of women, if you slowly stimulate that, it's very beneficial. It adds to a long-term pleasure. Let me mention something to you. A woman who cannot fantasize, she can rarely have an orgasm. And when we talk about fantasize, she not necessarily have to fantasize about movie stars. She can fantasize about her own man. That's good enough for her. And also for the men, should also fantasize about their own woman. This is good enough for them. So, there are devices. Let me be open and say something here. I said in a previous session, masturbation is normal. Is a normal sign, is a normal healthy thing that you masturbate. A baby masturbate. From 15 months to 19 months, they start masturbate. Yes, there is no fantasies because their brains are very much limited. They cannot fantasize about anything, but babies masturbate. They feel pleasure when they touch their organs. Yes, they don't have ejaculation yet. They don't have fantasies, they don't fantasize, but masturbation is normal for children, small children. Masturbation is normal for married men, for married women, for young couple, for old couple. Masturbation is normal. When it becomes abnormal, when it becomes a lot more than it's supposed to be, when you have to stop your work and go and masturbate. That's now pathology, that's the sickness. So much better to have your sexual partner full understanding so you don't have to masturbate. Because masturbating meaning failure of communication. If you have your wife or if you have your husband and leave that and go and masturbate, that means failure of communication. You have failed to communicate with your husband, or you have failed to communicate with the wife, and as a result, you rather do masturbation than a successful, good, emotional, loving relationship. Now, I got a message just now, the summary of it. I have a small penis, and my wife doesn't want to have sex with me anymore for the last 4 months because I have a small penis. I tell you, your wife is wrong. If your story is actually true, your wife is wrong, because the size does not make any difference. It makes a bit of a difference. I cannot lie to you. It makes a bit of a difference, but not that big of a difference. What is most important in a sexual relationship is the arousal phase, the excitement phase. This is the most important part. Sexual intercourse is just, let me just get to the peak and get it over with. But the most excitement in the arousal phase. Okay. Now we're going to be talking, it seems like this one session is not going to be enough. I thank the production for giving me a few minutes extra. But let's talk about something else so we can, for the sake of completion, let's talk about something else which is called pain disorder. Pain disorder. What is pain disorder? Can a woman have pain upon sex? Yes, of course. And the example we just mentioned, a postmenopause woman that have low state of estrogen. As a result of the low state of estrogen, we have low blood flow to the area, including the vagina. As a result of the low blood flow, we have thin wall of the vagina that is very much fragile. So we don't have lubrication. We have thin wall of the vagina. Now, if you have penetration with such a woman, it will pain her and she will bleed because there's no lubrication and the vaginal wall is very thin. So that is pain. So if she gets pain time after time after time after time, she will hate to have sex. She will develop fear of having sex. And that is going to be a problem. And we said the solution is very simple. You don't have to take estrogen by mouth. You can just put a small tablet of estrogen in the vagina and it will increase the blood flow and it will fix the problem. If you need to use lubricant, please do. Okay? So that is. Now, we have also something called vaginismus. This is the extreme version of pain disorder when it comes to sexual dysfunction in a woman. What is vaginismus? Don't worry about the fancy name. There are some women that, because maybe wrong beliefs, to them is the right beliefs, but, religious beliefs, such and such beliefs, bad sexual abuse before that happened to them, they develop what is called contraction of the outer third of the vagina. You cannot penetrate. She's contracted so hard that nothing can go in. This is fear. Can this be solved? Yes, it can be solved. We use specific dilators and then she will be fine. And also psychotherapy. What is the essence of, what is the backbone of psychotherapy? Communication. What is communication? I talk, you listen. You talk, I listen. That is communication. Communication between who? Between who? Between a husband and a wife. Those are the ones with the problem. You, as a sex therapist, somebody like me, for example, I'll just, target focus questions here, focus questions there, try to mediate the situation, try to promote. Know my likes and do it. Know my dislikes and avoid it. What applies to you applies to him. The same thing. Now, you have to know where is your sensitive spots. Sensitive spots can be discovered when you do masturbation. Most of you have done masturbation. Most of this women out there have done masturbation. They know what area, where to touch to excite them the most. They know. So convey this to the husband. Thank you very much. I took a few minutes above my time. I know the session was a bit short. I promise you next Saturday, stay tuned and we will continue. And I'm quite sure I already get bounded with a lot of questions. I'll answer all of those questions next session when I come, inshallah, next Saturday. Thank you very much for listening and God bless you all and have a nice, wonderful weekend.